Again, a very warm welcome to everyone from Cambridge. I am Simrita from Anglia Ruskin University. As you all know, this particular webinar will address the new forms of organizing in times of crisis in food and nutritional security for children in India and the UK, and the implications of the pandemic on organizational, managerial, and societal processes. As you are aware, there are new and ever increasing challenges facing governments every day. And there are many local communities, both in India and UK and charities as well, who have stepped up to respond to the immediate crisis of the pandemic. And these could be understood as alternative or new forms of organizing, which is basically in opposition to how conventional and mainstream organizations are known to function. Now, research shows that alternative organizing efforts are usually more context or domain-based, and they support the marginalized communities during the crisis and are often presumed to have a much stronger reach, more flexibility in decision-making given their flat organizational structure, and are also considered better at working closely with the marginalized population by virtue of direct participation. So our speakers today will mainly address how these alternative forms of organizing respond to unexpected events during a crisis. But before that, I'm very pleased to welcome and introduce you to Professor Anju Sharun Upadhyay, who is a professor of political science and a former dean of the Faculty of Social Sciences at Banaras Hindu University. And she has a glorious academic career spanning over 45 years, and she is also a specialist on food security. And she will give you some context and insight on this. So over to you, Anju.
Anju, you're muted.
Sorry, Jacinta, can you unmute Anju, please? Thank you.
Muting, yeah, thank you, Jacinta. Before we go, I think since most of us are here participants, maybe we can allow them to mute themselves rather than just intermuting us. That will probably work better. Is that okay?
That's perfect, Anju. And everybody's muted at the moment, but everybody has control to unmute themselves if they need to contribute.
That works better in smaller units, yeah. So very happy to be presenting the researches that were done by people who participated in this project over the past several months. The title, as Simrita mentioned, is that New Forms of Organizing Food and Nutritional Security for Children in Crisis. And very grateful to ARU, Anglia Ruskin University at Cambridge, for involving us. Us here is Center for Peace and Development in India, Nutrition and Health Study Group of Development Association of Ireland, and Academics Stand Against Poverty, the Irish Network, for including us in this exploration. We've been inspired by the current pandemic and the incremental changes that it posed to the governments. This research, as we know, was mainly focused on the initiative taken by civil society organizations, local communities, charities, and individual citizens in meeting up the challenge of contributing to food security for the younger and growing children of our states. What exactly motivated us, of course, was the pandemic. And as we all know, since December 2019, the world has been experiencing this global health crisis, the dimensions of which have not been experienced by our living generation. This crisis has disrupted our social, economic, cultural, all aspects of our lives, actually almost all aspects of human life. We witnessed and are actually still witnessing the emergence of a major food security and livelihood threat to millions across the world. And this pandemic has led to a serious setback to developmental advances that we have collectively made over decades towards ending hunger. According to the estimates, some 690 million people do not get enough to eat routinely. This was the time that more than that were affected by the lockdowns and by the pandemic. Over half of this 690 million people live in Asia, and about 10 million people are added each year to the total number of hungry people. Due to this ongoing crisis, it is estimated that the number of acute food insecure people across the globe will be doubled to 270 million in 2021. We are almost completing 21, and we are being threatened by the results or the impact of this pandemic. Now, why exactly do I bring it here? Partly because I've been busy completing a book on food security that should be out sometime early 2022, and these numbers are on our fingers, but also because India's journey towards attaining self-sufficiency in food production and evolving one of the world's largest food-based net is inspirational. And it's replete with learnings on food governance. Food security discussions in India are not limited only to the right to food, as we know, enacted in 2013, but it extends to its availability, to its safety, to affordability, and nutritional value of food products. And in this process, the government of India has robust schemes and programs in place that address food insecurity and malnutrition, such as the targeted public distribution system, the midday meal system, the now of course known as Pradhan Mantri Poshan Shakti Yojana, and the integrated child development schemes, services actually. And they're all covered under the National Food Security Act of 2013. Needless to point out that the government's initiative in this area has been massive. The midday meal scheme represents a predictable support and lifeline for millions of school children in the country. According to an estimate, there are about 13 crores in more than 11 lakh schools across the country that receive midday meal, which is now served as a hot meal to children till the age of 14 in government schools. It has a significant impact on children's daily diet, reaching children with not only stuff that will fill them up, but also with proper nutrients and micronutrients. And there has been a constant monitoring, supervision, as well as reinvention and administration of this scheme. So many, examples of reinvention can be like, what is the latest is what was brought to this scheme from the community, which is known as Titi Bhojan, about which Ankita will be talking later. However, it was the pandemic that the schools closed. During lockdowns, there were loss of incomes and as well as catastrophes in so many households that led us to focus on this very important segment of food security. The vulnerabilities of the marginalized led us to focus if the civil society organizations, individuals, new organizations that are coming forward in alleviating the suffering of hunger amongst the most vulnerable children and not so well-to-do people is working efficiently or not. We are aware that there has been a stubborn persistence of malnutrition in the country. There have been deep understanding to pathways that create barriers. However, we know that food insecurity and hunger have been both systemic as well as dynamic. Hence, there is a need to constantly review and revisit and assess how various factors are impacting these communities, and especially the most vulnerable, that is the children. So there has been a constant need to assess the gaps. There has been a need to reinvent. There has been a need to monitor, to supervise. But what was most important about this project was we went and inquired into all those initiatives that were being brought in place by individuals, by voluntary groups, by the society. And in this, we went to explore in Varanasi, which is also known as Kashi or Banaras.
Anju, you've gone silent again.
That, yeah, we get to know when we are silent. Thank you. So I'm about to, kind of wrap this up. I thought I've exceeded the time, so I was put on silent. So, so there have been, for instance, we explored what Roti Bank was doing in Banaras, collecting food and distributing it to the needy. We went and explored the Jeevan School, a small little initiative that was set up in early 2000 to provide education as well as nutrition, as well as a roof on their head to children of construction workers, to children of the, homeless people. And we were very happy to find that people with very limited means, even not so well-to-do people, are the ones who are who were coming forward, contributing to providing support or solutions to the hidden hungers. So there has been this challenge, and I'm very happy that today we will be presenting, and I'll be also listening to the work which was done by partners other than Indian partners, and of course not to miss Janamitra Nyas, from where Dr. Lenin Raghuvanshi is here, who will be presenting, and the main researcher, that is Ankita Raghuvanshi, will be presenting on the work we did in Banaras. And I myself look so much forward to following what Neeta has done. And so welcome once again, each one of us, and over to you, Samrita. Thank you.
Thank you, Anju. Thank you very much. Our next speaker is Dr. Neeta Mishra. She is also a specialist in food security, and she's currently a chair for Development Studies Association Ireland and director for Children's Rights Alliance in Ireland. And she's currently researching at the Department of Food and Business Development at the University College Cork. And she has a wealth of experience in this particular area. So over to you, Neeta, and she will be talking about this perspective from the UK.
Good morning, everyone. Just give me 2 minutes. I'm going to share my slides. And while I'm sharing, let me tell you, I'm also the coordinator for Academics Stand Against Poverty Irish Network. I just had to say that because we are co-hosting this event. Once I start the slides, I won't be able to see anyone on the screen. So if you have any questions, just put it in the chat and we can get back to that later. I've been part of this project from earlier this year, and I must say that it's been very useful for me, also because of my own PhD, which was looking at how rights-based approaches to the ICDS in India, the Integrated Child Development Scheme, has been operationalized in the period between 2012 and 2015. And those findings are already out in different food chapters in different books and journals. And one of them is in the book that Anju just mentioned. So thank you for being here, and please bear with me. I'll try and rush through these. If you have any questions, you can come back to me later. So while we were looking at new forms of organizing in food and nutritional security for children in a crisis, what I did was a literature review, and it was more or less based on social media or print media kind of literature because of COVID again. And and I had to, my responsibility was to look at tackling food poverty in the UK during the COVID-19 pandemic. And we were looking at how it impacted children's lives. So the structure of the presentation is, now I can't see my own slide. One second. So how children, how different organizations were coping with their organizations to cope to tackle the food crisis during the pandemic in the UK. And like I said, the literature for this paper draws from media, online social media articles, and government reports on food poverty in the UK in the period between 2020 and 21. First, I give you a background on hunger in the UK in the public domain with a brief on current government responses during the pandemic. Current meaning in that same period earlier this year. Second is on food distributing organizations, namely Fair Share and Trust, followed by a discussion on smaller food sharing groups. I know Fair Share is here today. So within Fair Share, I have focused on how it works with charities and community groups. Its strategy is very important, and role of individuals. Trust, Christian ethos, food bank networks, its social enterprises, and its focus on equality, diversity, inclusion aspects have been explored in the next section. And the third one looks at the smaller organizations like Smethwick Food Bank or Eastbourne Food Bank, and something where, and I do allude to something which is called the community stuff. So a background is, even before pre-COVID, there was an emerging food crisis in the UK. And when I share the slides, you can have a look at these these maps that show what kind of food crisis and how the need for food banks in local authorities have increased. The map on the first map shows that, in 2009 and then 2013. So already there was an increase in food banks, which tells us that there was a crisis emerging already. And then I just added this little bit of quote from Patrick Butler, which is 2017, again, to show that like this was till 2013. This is again 2017. People with disability or chronic illness who are in receipt of benefits were disproportionately likely to be referred to food banks, and lone parents, poorer families with 3 or more children. So these are the kind of groups we were also looking at. But then again, increased conditionality and sanctions, the benefit cap and reductions in tax credits, all of that was not helping food security. Our observations that these groups are disproportionately needing help from food banks is unlikely to be a coincidence. And that's what Rachel Loopstra was talking about in her article in 2017. So what is interesting to see is that 2/3 of those who used food banks were aged, quite young, 24 to 39, with only a tiny proportion of users classified as pensioners. So what we are looking at is an increasingly younger population, which was not food secure in the UK. Now, UK is a developed country, remember. We are not talking about a middle income or a low income country. So just a second, I can't see this. So it was the young people's shame, guilt, and sense of exclusion from normal everyday activity that hit hardest. And this is again food poverty and its impact. Louise Tickle's article in 2020 is something I have heavily drawn on. So there are quotes like, if there isn't enough food, we'll get it. And sometimes mom will go hungry. Even if it's not that much food for us, it's enough that we've actually had something, whereas mom hasn't. So, this whole idea that the mother eats last is not something that happens only in India or African countries or somewhere else in the world. It is happening in the UK. So Tickle highlighted challenges related to food poverty, again, which we were talking about 2009, 2013, 2015, 2020 also we've had the same problems arising out of 0-hour contracts, disabilities, learning difficulties, mental health issues, families with no savings, or situations where families had to forego food to deal with an emergency where money was needed somewhere. So low-income families were the hardest hit. We know that happens all over the world, but this is the UK. So then Fair Share, I am going to quickly go through the Fair Share slides. So it is a national network of charitable food redistributors. It works with charities and community organizations. It also says that frontline organizations are better equipped to provide adequate support to get people back on their feet. And FairShare's ethos has been on fighting hunger, tackling food waste. Now, tackling food waste is something which is increasingly coming up in food security debates and sustainable food systems. And this is something that FairShare has been trying to do. It's clear from its campaign, and I really like their campaign, their slogans. Give a hot meal, just one thing, activate, and feed people first. So these tell us the ethos. Now, what I'm trying to bring in here is that organizations do not have to be it's not about how well you are. It's about what is coming out is interactions, human interactions between people, and that is something Fair Share or Trussell Trust or Smethwick Food Bank or the other food banks have been bringing to the fore, the importance of that human connection. So, for example, if you look at the Fair Share Go service, during the pandemic, these charities could access free food from supermarkets or their community organizations through this, or one of its 21 regional centers. So when I did this research, they had 21 regional centers, and which retailers include Tesco, Asda, and Waitrose and partners all over the UK. They had an urgent COVID-19 appeal calling for donations, food, and volunteers. They had COVID-19 safety food arrangements, arrangements at the site, where they had the food. So this is in my document. We are planning to publish the paper, so I cannot share it here, but there are details in the paper which is going to come up. It's very simple stuff like, wearing your mask and wearing gloves and making sure that the food is safe and not contaminated by possibly by the virus. So the other thing they focused on was smooth flow of food provisions for children. There's the process to access food entitlements was simplified. So if you go on their online website, it'll say, for example, how do I sign up? Now, when people are hungry, it is difficult for them to think about these things because there's chaos and these are very simple steps which FairShare took control of. So the chief condition attached to receiving food was that the organization the charity or the community organization, it must be equipped to receive, store, and redistribute food safely. So that was a condition for FairShare to give the food it collected or share with other organizations, deliver fresh and good quality food within its shelf life. Now, this is important. It's not about food that was old and needed to be, you needed to get rid of it. It had to be within the dates. So another thing that FairShare did bring about, like we've seen in other kinds of organizational growth, is the role of individuals and this was transformational from what we see now. So footballer Marcus Rashford, we've been hearing news about him. We hear every other day you hear something, and that was I think it was very strategic to bring Rashford into it as an ambassador of FairShare since March 2020. His own lived experience has been through these food banks, and he says his family relied on breakfast clubs, free school meals, and food banks. So it tells us how crucial these food banks have been. And so you needed people like that to bring out, to share their lived experience. And he clearly said the system was not built for families like mine to succeed, regardless of how hard my mom worked. So again, the role of the mother or the woman of the household becomes so crucial. And so more recently, Rashford and Chef Courage have introduced a new initiative called Full-Time Meals. And this is something that is, I've given you the link here, which is, how to have healthy and, tasty food in quick, in a few minutes. So you could have a look at that. And because of FairShare's and Marcus Rashford's involvement, they spearheaded the Child Food Poverty Task Force. And that is the report that I was talking about in the earlier slides. Then we come to Trussell Trust, which is again a very big trust in the UK, and it was founded in 1997. It's got an interesting story. Initially, it worked with children sleeping at a Bulgarian railway station. In response to a mother's call for emergency food for her children in Salisbury, they founded the Salisbury Food Bank in 2000. Now, this is very old. In a garden shed, providing 3 days of emergency food to the hungry. And how beautiful this is. Church networks were important for Trussell Trust, and currently there are 1,200 food bank centers supported by the trust. It draws its inspiration from the gospel in the Bible, which reads, "For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was in prison, and you visited me." And I think we need to take strength or inspiration from anywhere that we can get in times like this, because hunger and starvation is something that can lead to other forms of challenges, social challenges. So these are some, on the right side are some statistics if you want to have a look. And so Trussell Trust published the 2 state of hunger reports. Sorry, I cannot see the topmost sentence or the point because of my, sorry, I can't do that. So you can have a read of that. So they published 2 state of hunger reports and on the impact of COVID-19 on vulnerable groups with an emphasis on structural inequalities based. Now, this is interesting. It is, we can see that race, disabilities, sexual orientation, and gender, which fall under the equality, diversity, inclusion kind of a, if you have to mainstream EDI, this is how you do it. So organizations like Trussell Trust started looking at where the differences and why some people were accessing more than the others and why some kind of groups were going more hungry than others. To make its work more meaningful and to tackle structural discrimination in society, they decided to make EDI core to their mission and the other core mission was to end the need for food banks, but as we have seen, it seems to be increasing. Values of dignity, compassion, community, and justice are embedded in its work. We are looking at a world which is going towards values, which is coming back towards the importance of social values in society, in our interactions with each other, and that is, I think, my major finding or my major input for this work, and I want this to be taken into all the other work that we do. So dignity and interconnectedness, a clear focus on transformations and it calls out for changing minds, changing policy, changing communities. And the trust envisions a UK without the need for food banks. To genuinely address the root causes of poverty, we must ensure people with lived experience of poverty shape our work, and that's core. So the trust also supports the Stop Hunger movement initiated by Sodexo, which is a coalition of charities working in partnership in 40 countries. And this movement aims to tackle hunger and malnutrition, support healthy lifestyles, and develop life skills, such as teaching children how to cook nutritious meals. I just cannot see the top line. So that's something that I have already said. Anyway, this is under Sodexo Trust. The Trussell Trust also initiated a social enterprise approach with refers to creating income generation opportunities through the sale of secondhand goods and services for people with low incomes. Now, to come back, these community shops, which are also emergency food collection centers, offer volunteering opportunities to engage locally through its 10 community shops and a warehouse. And they also hold a hatta, a fortnightly market, where there is a recycling of books, textiles, DVDs, CDs, is all there. But this, I'd like to link it to the current environmental movement around this on circular economies or the Cinderella economy, or on the whole ethos of recycling and reusing stuff. So I think this is where we are going, and it is not just about people with low incomes. It's about people like you and me also, who should be probably going for more of recycled products, and that includes clothes. So working through trade to tackle social problems, improve communities, people's life chances, the environment, and create employment opportunities is again part of their ethos and their strategies. And they also say our shops are designed to do more than just raise funds. Each shop aims to become a hub of the local community, like the community centers. And I think that's the beauty of it. So Smethwick Food Bank is again a smaller one. It is part of Trussell Trust, and it was founded in 2004 in Smethwick. So in 2019-20, this network provided 1,900,122, include, all of these numbers. You can have a look. It look at the number of number of children they have provided food to, and they do give 3-day emergency food supplies to people in crisis. Strategies focus on developing new ways to help people out of poverty, and their program is more than food, then emergency food, and they also receive in fact their website talks about how they help people who find themselves in crisis for a different number of new reasons, also from redundancy to receiving an unexpected bill on a low income, on an already low income survival strategy. They're volunteers. Now this is important, and I took this picture from the website. The role of helpers is crucial, and over 40,000 people volunteered their time for this work. The volunteers, there's somebody who said this, it's a quote: "The volunteers were fantastic, offering a chat and a shoulder to cry on. I suffer from depression as well, and without the food bank, I don't think I could be here today." So this is something about trying to be a local community hub, and this is the core of the message, of the food banks. So what are the strategies of these volunteers or of the trust? Is to identify people in need for food vouchers, food banks. How do you identify? You take the help of care professionals from the health sector, from social workers, and also from the police. The local citizens advice bureaus also are a key source of reaching vulnerable people. So their whole mandate is to try and reach people who are going hungry, and there could be sudden, reasons why people are going hungry. Help on a range of issues, including money management, employment opportunities, homelessness or its risk, and how to manage debts and training courses for various jobs when possible. So you're looking at you're looking at a strategy and a model which is more or less sustainable, which is also building capacities of people. It's not just about an immediate help. It's not a practical need which is being met. It is very strategic also. So then I have another example of Eastbourne Food Bank. It's relatively a richer part of the UK, but the history of the food bank shows that food poverty has risen since it was established in 2011. And it has grown in size, moving from a small church premise to a larger warehouse. And the number of people there is an increase in the number of people in relation to hunger-related incidents. And it also, if you go to the website, it'll tell you more about how different types of groups are accessing there. For instance, although it's a richer part of the country, a mother was found rummaging a bin to feed her children, after which she collapsed due to malnutrition herself. So there is a stark the stark reality is that people who are richer or people who are better off have only gone better off, and people who are poorer have gone poorer during the pandemic, for example. Again, they also give 3 days nutritionally balanced emergency food. The word, nutritious food is very important, because you can't just give any food. So it has to have shelf life, it has to be nutritious. They also give toilet items to those who need. They give welfare benefit advice. So this is again how to manage money, where to get access welfare benefits from the state. So debt advice, home start advice, how to, with offers of bedding, blankets, crockery, etc. Best start with, for new mothers, they give prams, these are all recycled stuff. So it is kind of looking at not just practical needs, but also about strategy, in long term. They want to build community which is self-sustainable. They can rely on each other, and that's important. There's something called community stuff, which I came across also. So this deals with, again, the local food bank and the local produce. Food poverty has emerged as a priority for them. They run cookery classes to teach how to make nutritious food within very low budgets. They also run Friday lunch club for socially isolated and lonely individuals as a way to deal with mental health issues during COVID-19 lockdown. So we are coming up with new forms of organizing for food and crisis when you look at, have a deeper or in-depth look at all this. So what we see is, to conclude, is the ability to listen to people, to share your stories amongst others of similar, with similar problems, and newer hunger, a community which is slowly, probably more looking at each other for respect, for dignity, for well-being, and to the food banks also to Trussell Trust or Fair Share or Eastbourne or the different food banks. And I think the role of the volunteers becomes very important here, because they are the ones who are facilitating these values amongst these food hunger communities. And it also shows that the management of these big trusts are adapting themselves to the pandemic. It kind of focuses by forcing there was a child food, the task force on food in the first, what's the thing I said? We can come back if somebody puts up a question. I can bring back, to show that there's a preparedness and political will and commitment of the food banks, organizations, and the country. We are seeing it's coming slowly and gradually. The country is realizing that food poverty is a big issue in the UK. So fighting hunger at various levels and tackling food waste is again crucial for the strategy of all for what has come out from the research. And to genuinely address the root causes of poverty, they're saying one of the final things which comes out is there has to be a careful planning at local levels and the province level and the state level. Feeding a family on a severely restricted budget is possible if money is tight for a few weeks, but not for years on end. So this is a quotation from a mother, from Claire Hackney of Community Stuff. And she's saying this quote actually stands true not just for families, but also for the state government or for policymakers to look at, we are not looking at something that we need to deal with right now, but it has to be long term. And this is where I will stop the references go on. So you can have a look at that when the slides are shared. But thank you for listening to me, and I'm trying to now stop sharing.
Thank you very much, Neeta. That was very insightful. I'm just conscious of the time, so we can take the questions later on when all the speakers have finished presenting. So our next speaker is Ankita, and she was also collecting the data in India. So Ankita, you can start sharing your screen now. So Ankita is actually currently pursuing her PhD in peace research under the UNESCO Chair for Peace and Intercultural Understanding. And also, she holds a specialization in public administration. So over to you, Ankita.
Thank you so much, Dr. Sundrita. Am I audible to everyone?
Yes, yeah.
Is my screen visible?
Yeah, it's perfect.
Okay.
Yeah, perfect.
So, good morning, good afternoon, and good evening, everyone. As part of this project, I'll be talking about the Indian perspectives with regard to the new forms of organizing in food security for children during crisis times. So let's get started. Food security and global statistics. I would start by referring to the Global 2030 Agenda, We are aware of the SDG 2 that talks about ending hunger and achieving food and nutritional security for all. This is where this project aims to contribute. The goal has 5 targets, and the first one, that is the SDG 2.1, says that by 2030, we have to end hunger and ensure access to safe, nutritious, and sufficient food all year round to all people, in particular to the poor and to the vulnerable. That includes infants and children. Now, to monitor the global progress towards SDG target 2.1, the Food and Agricultural Organization uses the prevalence of nourishment indicator. Until recently, they've used this, but they have now introduced another indicator to assess food insecurity by using prevalence of moderate or severe food insecurity based on food insecurity experience scale. The 2030 agenda, by including this indicator, recognizes that food insecurity is more than just hunger. So I'll take you through this. The green part here reflects food security. The yellow part represents moderate food security, wherein people experience uncertainties with regard to their ability to obtain food and are forced to compromise on the quality and quantity of food that they ultimately consume. The red part here, it reflects the severe food insecurity, wherein people typically run out of food, or they go on for days, if not one day, without any food at all. And this is how the global progress towards the goal is monitored using these parameters. To understand it further, food insecurity beyond hunger shows that 17.2% of the world population, or 1.3 billion people, have experienced food insecurity at moderate levels. This means that they do not have regular access to nutritious and sufficient food, even if they are not necessarily suffering from hunger. They are at a risk of various forms of malnutrition and poor health. So this basically works as a vortex, because once they're malnutritious and sick, they're further excluded from what they are actually able to get, and then they're pushed to the severe food insecurity level. The combination of moderate and severe levels of food insecurity brings the estimate to 26.4% of the world population, amounting to a total of 2 billion people. As per the FAO report on food security and nutrition that came out in 2020, even after 5 years since the international community got together and formulated the global agenda for 2030, we are still neither headed towards the target 2.1 nor towards the SDG target 2.2 that discusses the eradication of all forms of malnutrition. The report analyzes many roadblocks in the process of achieving food and nutrition specific targets of SDGs, and these includes climate change, climate challenges that come along with climate change, internal conflicts, minimal efforts made by state governments towards ending hunger and tackling undernutrition, economic slowdowns, and so on. And now we also had the pandemic crisis. The unprecedented COVID-19 pandemic in 2020 not only pushed the situation to worse. Even before the pandemic, the stats were already concerning, but as per the projections made by the report, the pandemic is set to add another 83 to 132 million people to the number of population already affected by chronic hunger and malnutrition. Now, coming to the food and nutritional security of children in India, let's begin by looking at some stats. India accounts for world's highest proportion of stunted children, that is 31%, and wasted children, that is 51%. This is as per these reports of 2020. Similar reports in 2018 highlighted that the prevalence of undernourishment in India decreased from 22% in 2002 to 14.8% in 2017. And stunting in children under the age of 5 also plummeted from 54% to 38% in 2002 to 2015. However, India still is home to 24% of world's most undernourished people, and the number are still high in prevalence when compared with the global average of 23%. Now, with the view to adhering to food and nutritional requirements of marginalized children, Government of India launched many flagship schemes, including Integrated Child Development Scheme, Midday Meal Program, National Health Mission, National Nutrition Mission, amongst others. And MDM scheme here is our case in point. The program was launched by the Government of India back in 1995 as a school feeding program for children between the age group of 7 to 14 years to tackle malnutrition among children and to increase overall school enrollment, attendance, as well as retention. In an important move, the scheme in the year 2007 was extended to cover all government schools, including government-aided schools, and most importantly, alternate inclusive education centers such as madrasas and maktabas all over India. The MDM scheme, just like Professor Upadhyay highlighted in the beginning, has served about 90 million children in 1.13 million schools across the country. Though sponsored and implemented by the government at the union, at the state level, the MDM is essentially a community-based service that is responsible for the provision of fundamental nutrition of children belonging to the marginalized groups. The program has been significantly successful in achieving its goal, which was school enrollment, attendance, and retention, and had become one of the significant approach to safeguard the nutritional security of young children. Now, I say it had become because now the government has rolled out the replacement of MDM with the introduction of PM Poshan program, which is essentially a revitalized, revamped version of MDM. PM Poshan has been launched for a period of 5 years from 2021 to 2026 with a budget of a whopping 1.3 billion rupees. While the MDM focused solely on providing nutritious meal, the PM Poshan program will also monitor the nutritional levels of school children, among other things, and as such, a nutritional expert is to be appointed in each and every school. But since the Union Cabinet has recently approved the program only about a month and a half ago, thus this PM Poshan program remains out of the purview of our study. So coming back to the MDMs, the onslaught of COVID-19 and the subsequent imposition of lockdown all over the country led to immense challenges, and the schools were being closed down. This led to disruption in key welfare services, shortage in food supply, and steep increase in trauma. Government was, however, quick to take the cognizance of the matter, and in April 2020, it was announced by the Union government that all the states and union territories were to keep up with the mission behind MDM scheme and were to continue with the provisions of the scheme by either making arrangements for door-to-door supply of dry ration or supplying cooked meals on home delivery basis, or by compensating through a food security allowance directly into the bank accounts of the beneficiary household. However, it wasn't as simple. The major factor impeding the envisioned distribution is considerable disparity between urban and rural areas that has affected the interim measures to become an on-ground reality. Uttar Pradesh, Bihar, Madhya Pradesh, these are some of the major states which were worst hit in India during the pandemic. UP already had a recorded number of 0.3 million under 5 deaths due to child and maternal malnutrition. And just as it had been predicted, we have witnessed how pandemic has only made these numbers worse. And talking about the urban and rural divide, upon comparison with the urban areas, this ratio is 10% higher in rural areas for stunted children under the age of 5. The Global Hunger Index has ranked India below Bangladesh, Nepal, and Pakistan. These are neighboring countries of India, which have lesser resources as compared to India. And the situation indeed is very alarming. Now let us discuss new forms of organizing or alternative organizing. Just like Dr. Sunrita talked about it in the beginning, how the pandemic has paved way for severe social challenges, and there are debates everywhere, whether centralized or decentralized or a devolved system of governance and decision makings would be the best to deal with immediate crisis. With new and ever increasing challenges facing the government every day, local communities, charities have stepped up to respond to the immediate crisis of the pandemic. As the abrupt lockdown was being imposed all over, people were facing severe hardship due to loss of job, financial distress, widespread hunger, distorted relief packages, and the list just goes on. There were so many things. It was the local community members that came forward and assist all those who were in need. These community level organizing could be understood as alternative or new forms of organizing, which is basically an opposition of how conventional and mainstream organizations are known to function. Alternative organizing are presumed to have a more stronger reach, more flexible, they show more flexibility in their decision making, and are considered better at working closely with the marginalized population by the virtue of direct participation. Alternative organizing also refers to organizational practices that are more creative, untried, or untested. In general, new forms of organizing essentially comes up to fill the gap which is left by the public and private sector, and of course the civil society organizations to an extent sometimes. Now, you all know perhaps the objectives of this research. I'll be skipping this. I'll be talking about the approach and methodology. The study is approached using the ground theory, and hence the use of purposive sampling has been deployed, which was also attempted to be used given the pandemic. The organizations selected here are the Roti Bank Varanasi, the Jeevan School from the Jeevan Samaj Seva Siksha Samiti, and Jan Mitra Nyas. All these three organizations have been selected on the basis of non-probability purposive sampling. Telephonic interviews were conducted, and analysis has been done through the process of constant comparison, wherein the information gathered is simultaneously compared to the information already collected. Now, moving on to the case study. First of all, I would like to talk about the Roti Bank Varanasi. It was started in November 2017 by Mr. Kishore Kant Tiwari. And I would like to share with you that we interviewed Mr. Tiwari in February 2021. He was such an energetic young man, full of compassion for the work that he was doing. And he was quite optimistic about the whole thing, feeding people, tackling hunger one person at a time. And we did the interview in February 12 to be precise. And in April, we heard the news that he was affected by coronavirus in the process of his service. And his condition was deteriorating. He was sick. He was admitted to hospital. And before we could know more, he passed away. And this presentation, whatever the work we have done here in India, it's all dedicated to Mr. Kishore Kant Tiwari, who is no more between us. And it's also dedicated to others like him who are fighting hunger and malnutrition on the front, on the ground, like a true warrior. Now coming to the Roti Bank, it's basically a food rescue organization that works towards bridging the gap between food and between excess food and hunger. It was established with an aim to eliminate hunger from Varanasi so that no one would sleep hungry in the holy city. Going on to the organizational structure of Roti Bank, it is quite a flat organization because essentially it was like a one-man army for some time. Even after almost 4 years of its operation, the organizational structure is still flatter, where the founding members and other members are open for direct communication, eliminating any layers within the organization and making the leaders absolutely approachable. Along with this, the members are free to choose a role that they think they would be able to do the best. So essentially, job titles are the roles structured around work, and thus a member can hold multiple roles. Also, the organization for most part is self-managed and people have no concrete titles or designation. And the most interesting part is members of Roti Bank are mostly the people who have full-time or part-time jobs, or some of them are even students. So the initial work of Roti Bank was very simple. The organization would pick up excess food from weddings, events, hotels, housing colonies, and deliver it to hundreds of hungry people in need who would be living in destitute, whether it was orphans or beggars or handicapped, or even people from poor families who would come from far-flung villages to Varanasi specifically for medical purposes. I would skip and quickly go to the organizing in crisis part, wherein after the outbreak of COVID-19, Roti Bank and its member worked in front lines by taking up their work a notch further and working more rigorously to cover wider number of backward areas and localities with poor population in the city, especially feeding children. So earlier, whereas they would be working in very specific limited localities and they would be working only during evening, every day evening at around 9 p.m. Now they really had extended their work. They were also delivering in day, they were doing it in night. And they were just trying to reach out to as many needy people as possible, which included migrant laborers who were passing from the city. And as such, on an average, the bank managed to distribute approximately 500 food packets on a daily basis to people in need during the pandemic. The organization was recently in headlines when a renowned Hindi film actor, Mr. Sonu Sood, talked about their work and did a brief coverage on the functioning of Roti Bank in Varanasi. In fact, the image that you see here, it's a screenshot from the coverage that was done. Moving on to the next organization, that is the Jeevan School by Jeevan Samaj Seva Siksha Samiti. It was established in the year 2005-2006. It was founded by Mr. Sheel Chandra along with a group of individuals that included locals and a few foreigners who were living in Varanasi for studies or for work or for spiritual seeking. And it started with a very noble intention to provide a safety net for particularly vulnerable children with a variety of traumatic experience. They were the survivor of sexual abuse or physical violence or malnutrition. And the idea behind the school was supposed to be a safety net, to provide a safe space to these children who come to who would come to the boarding school and experience a safe and non-violent place where they can discover their own selves and have peaceful interaction with others. The organizational structure of Jeevan School is more team-based, where all the members and employees work as a team with the focus on problem solving through cooperation. This definitely results in an increase in the overall output of the organization, and it also boosts transparency. But as such, there's also a lot of uncertainty involved, because no matter how orderly or organized the jobs are, ultimately the output of the organization is still less tangible. I mean, given their humanitarian and social objectives. So it makes it very difficult to measure the deliverables, and hence leads to a state of confusion within the organizational structure. And we'll soon see how. So the initial work of the organization, I mean, I won't go in detail, but MDM was a part of the school regime from the very beginning. And though in the beginning it was in a very rudimentary form with just some porridges and fruits, but soon within an year of its establishment, they were providing full-fledged meals to these students who were coming to the school, who were staying in the school. And this was all managed and done and sponsored just by the founding members of the organization. And they would cater to at least 150 people on a daily basis. Since the school had this tradition of not just giving out food, but giving it with a lot of care and concern. So once the lockdown was imposed during COVID-19, school's initial response was to cook and deliver food door to door to all the children. And they also prepared a simple meal of rajma chawal, and they started their door-to-door drive. However, it soon became unsafe to step out and do this kind of delivery, and situation was only getting worse. So to tackle this, they decided to hand out packets of dry ration, and they did it in a very organized way. They prepared a whole list of beneficiaries, and this list of beneficiaries did not just include students who were enrolled in the school. It also included children and needy people in the neighborhood area who were living around the school. And thus they had prepared a list of 500 to 600 people who were to be fed on a daily basis. And now the challenge part started. They had to approach the local thana, the police station, to acquire the approval for handing out these dry ration packets. But they were denied, and after several rounds to and fro, they finally received the approval. And then there was an overwhelming response, because the word spread it out that the free ration is being distributed by the school. So the members, they didn't want to disappoint people, so they buy extra ration packets. But in all this, the organization is still not losing its order and its way of doing things. They arranged for a drop box outside of the school gate. They requested people, the needy people, to come and drop their names and phone numbers over there. They would hand them out a number and then the dry ration packets. And this is how they were doing it. But soon it was not working out, because apart from the daily wages who were actually the worst hit during the pandemic, they had no ration card, no social security. Apart from those, there would also come people who would comparatively better off, and they would pick up these dry ration packets and they would sell it out for little amount of money. It was that bad. And soon the pandemic got worse. The virus was spreading like terribly, and the lockdown imposition was being tightened up. So the kitchen staffs were unable to show up, and catering to such large number of people, their funds dried up and they were not able to continue with this drive. Moving on to the next organization, Jan Mitra Nyas. It was founded in 1999 as a public charitable trust in Varanasi. It was founded by Dr. Lenin Raghuvanshi and Ms. Shruti Nagvanshi with a vision to ensure basic rights of marginalized groups. and to establish rule of law through participatory activism against hunger, bonded labor, and injustice caused by the caste system. The ideology behind Janamitra Nyas is inspired by the father of Dalit movement, Dr. B.R. Ambedkar, who struggled his whole life against the caste hierarchical system prevailing in India. Now, the organizational structure of Janamitra Nyas is quite functional, where the highest level of responsibility and decision-making starts at the top and goes further down from there. Each of the departments, whether it is related to women, and I mean, it's a huge organization. They do a lot of work. It was established way back in 1999. So they involve and engage in a lot of activities, whether it's women and child, human rights, violence and abuse survivor, child education, whether they have, and then they have the departments for social media management, finance and accounting, campaign, advocacy, networking and partnership. All these departments have dedicated team of staff who are skilled in their field and thus have been assigned to that particular division. This has allowed the member staff to focus on their specific role and contribute better towards the overall organizational performance, while encouraging self-determination within the departments, within the division itself. Now, as for the initial work that was done by Janamitra Nyas, I'm just taking the liberty of moving forward very quickly because we have the man himself, Dr. Lennon Raghuvanshi, who is, I'm sure, going to talk about these things in details. I would be focusing on what the organization did during the lockdown. So with the support of other organizations, not just the local organizations located in Varanasi, but also like organizations which function on the national level, they distributed over 3,000 packets of food to children along with high quality masks and gloves to community workers, sanitation workers, police personnel, and anyone who was in need. Apart from this, the organization worked tirelessly to generate a comprehensive list of 15,000 families which did not receive any support. And this list was provided to the state government, district administration, which resulted in some of these families receiving food grains and ration kits and other necessary support. So liaisoning. Janamitra Nyas also collaborated with local community organizations, and they started a neo-Dalit community kitchen in Varanasi, which was started to feed a family of 60 people who were all daily wagers and who all belonged to extremely marginalized section of the society. This was done particularly in the Chowka Ghat area of Varanasi. These family, as I said, they mostly belong to the marginalized community, the lowest of the communities. And the organization also worked extensively and distributed rations to tribal families in extremely interior regions, extremely interior villages of districts other than Varanasi, all in cooperation with the local administration. Alongside, the organization also provided sanitation kits to around 700 people. They provided protein powder as nutritional supplement to pregnant and lactating mothers. They provided tablets of calcium and vitamin D tablets, multivitamin drops to children up to 3 years of age, and they did a lot of work. With the help of its volunteers and members, the organization reached and touched the life of approximately 25,000 people in 4 districts of Uttar Pradesh. The staff members of Janamitra Nyas were also involved in intervening the cases of violation of food security and torture, and they were doing this through constant email petitions, media interventions, phone calls, and follow-ups with the officials during the entire time of the pandemic. Now, to conclude, the SDG 2 and SDG 3 talks about complete eradication of hunger and malnutrition. This could be guaranteed through whatever we studied during this time as part of this project. We think that this could be guaranteed through strengthened decentralized institutions, because even the best of policies are going to fail if the implementation is shoddy. And implementation happens at the local level. It goes down to the bottom of our society. All the schemes drafted for the upliftment of citizens eventually become a local affair. And thus, swift and empowered local councils and a mechanism of strong, vitalized community-based organizations become very necessary. So when our Prime Minister talked about being vocal for local in his first address to the nation during COVID, it was not just in the economic sense of the term. It should also be considered to strengthen local grassroots organizations, since these have always actively come forward to provide a hand-holding support to the marginalized community in the most difficult of the times. From the study that we conducted with these 3 organizations, we would conclude that in the times of crisis, the decision-making in in new forms of organizing is best done at the highest echelon of any organization, whether it is a flat organization with perhaps just 2 or 3 layers of hierarchy, or a more functional organization with a stronger, comparatively stronger hierarchical structure. It would also be concluded from the study that alternate organizings, whether big or small, they all have a better outreach, they all showcase better performance, have higher rate of success when they come together to collaborate with other organizations. That is all from my side. Thank you so much for listening so patiently. Thank you.
Thank you, Ankita. That was brilliant. It was so insightful. Thank you so much. I can't wait to hear from Dr. Raghuvanshi later on. But before that, I'm very pleased to have Nigel from FoodShare. And Nigel has already recorded his presentation, so we'll play it for you. So Nigel is the founder and trustee of FoodShare, which is a UK charity that feeds people who cannot afford to eat properly otherwise. And he's also a founder of the Inclusivity Project, a non-profit organization developing theories around economics of well-being. And his introduction will talk a lot about that. So over to you, Nigel, if you would like to just say a few words, please.
Thanks. Just very briefly introduce the videos. I've actually done 2 videos, but there's just too much interesting stuff on the conference, so there's only time to talk about one of them. The one that we're not showing is the one about FoodShare. FoodShare is a local food bank in Maidenhead, and we just provide a lot of the practical insights of setting up and running a food bank that we've already heard a lot of talk about. So the talk, I think, reinforces and highlights and underscores quite a lot of what we've already heard about. But it also provides, if like, a practical insight to how this informal organization bubbles up and adapts to the specific local needs. And it talks about hierarchies and the impacts of how well or poorly these things can run. So for anybody who wants to watch a little bit more about how a food bank develops and some of the practicalities firsthand, this video, I think, is being shown after the end of this conference. We've also going to be providing a link in the chat box for anybody who wants to watch it in their own time. And for anybody watching this later who doesn't have access to either, if you just go to vimeo.com and look up FoodShare's contribution to food security, and you should find it. But the video we're just about to watch from the Inclusivity Project is based on the premise that food insecurity is indivisibly connected with much wider form of physical and emotional insecurity. And the premise is that we'll never solve food insecurity if we don't solve the wider structural problems. So the video that we're just about to watch talks about some of the structural problems and introduces how higher level government and larger organizations might rethink their solutions to food insecurity from a higher perspective, and the implications that has for the people who are working in there as to how to adapt the way they operate and act in order to implement some of the wider concepts without changing what they're doing. It's more about how they work than what they do, in order to implement some of these changes with a view to a longer term solution rather than a sticking plaster problem to hunger and food insecurity, a much deeper and longer term solution. So that's what this video hopefully will give some insight towards. Thank you.
Thanks, Nigel. I'm just going to run it now.
Hi, my name's Nigel. I've just spoken to you in my capacity as a volunteer at FoodShare. I wanted to talk to you now in my capacity as a supporter of the Inclusivity Project. And the perspective I wanted to share with you is a slightly unusual perspective because it relates to the structural perspectives by which organizations can develop new ways of addressing food shortages. So because this is quite so unusual, I wanted to go through a couple of concepts briefly to try and explain the principles behind what we're talking about. And the first thing I just wanted to run through idea about causes of food insecurity. And there's two overarching causes or impacts of insecurity. One is the acute food shortage. And this typically relates to things like war, environmental disaster, earthquake, tsunami, a refugee crisis. And the typical characteristics of acute insecurity are that they tend to be on a shorter term. And they tend to deal with much larger numbers of people. So they're quite large in scale. And it's best suited to solving them with what I call sticking plaster solutions. You see someone who's hungry, feed them. That's the best solution. It's urgent, it's immediate. And typically with the larger scale initiatives, it's very difficult for voluntary organizations to muster enough support to deal with it. So typically these are dealt with by governments or institutions. The other causes of insecurity is chronic. And this typically comes by things like economic failure, poverty, exclusion. And the nature of chronic insecurity is that it tends to be much longer term, have much deeper roots that go right the way throughout the whole of society. They tend to deal with smaller numbers of people at any one time. And to deal with chronic problems, and this is really the purpose of this presentation today, there's a component that if someone's hungry, you need to feed them, the sticky plaster solution. But there's another component, which is if you want to sort out hunger in the longer term, you really need to look at structural solutions. So this talk is about the structural perspectives relating to food insecurity. So I just firstly want to give an idea of what we mean by hunger and how we perceive it. And I've just illustrated three communities here. One community is extremely wealthy. They have unlimited supplies of as much food as they want, not just for survival, but for pleasure. The second one is what I call a much more typical community, the average middle-class person in any country, where they have access to food. These are two different communities. And the third community is the one that doesn't have enough food. In this example, you've got someone who's homeless, but there can be any number of people. What I want to identify is that we perceive these as three separate communities. And when we're dealing with hunger, we can go straight to community, in this case, community 3, a hungry community, and try to solve it or to deal with the problems that they've got. And a lot of the talks that we've had today will deal with this type of identifying a community that's in need and finding some type of sticking plaster solution which is most appropriate to their circumstances at the time. So that's the perceptions that we currently have of hunger. Let me delve down a little bit deeper into the reality of hunger. So this is a slightly complicated chart, so let me just explain it. But this really gets to the nub of what I'm trying to talk about with the structural impacts. So in this case, you've got various inputs to an economy, and the inputs come from people. So people's activities are involved in the economy. Put the people's input through. As a side note, because it's such a key issue at the moment, you can have another category of inputs, which is resources. And of course, that's where we get climate change and sustainability from. So let me just put that to one side, because I particularly want to focus on the people side of things. And you can see that there's the three communities that are input into the economy. And I just want to define the economy, because some of us have different ideas about what we mean when we talk about economics. So I'm going to define the economy as the coordination of human-centric input, that's activities, to deliver human-centric output, that's well-being, sustainable well-being, as it turns out. So I just want to focus on the human-centric side. A couple of the particular aspects of this is an economy is about coordination. So when we're dealing with with hunger and addressing hunger, it's important to recognize that what we're talking about is coordinating people's approaches and responses in an effective way. And I want to talk a little bit more about what we mean by the output, because I also want to give put food in a slightly wider context. But I just want to stress that the effectiveness of an economy is about how well we coordinate everyone to do appropriate activities to deliver the appropriate output. It's how well we coordinate humans, people, to do the right thing, to get the right output. So I want to talk just a little bit about what we mean by output, and particularly focusing on what we mean by on the aspect of hunger. And in this sort of slightly modern way of looking at an economy, we're not looking at wealth creation in an absolute sense. We're not looking at monetary GDP. We're looking to increase it year on year on year. What we're looking to do is to increase human well-being year on year on year. If it happens to correlate with monetary increases, great, but it's actually secondary. The primary output of the economy is human well-being. And there's two aspects to well-being which the economy generates. One is food or physical security. Food is a component of physical security. Having enough to eat, you can't survive without it. We also need to have shelter, protection from the elements, protection from animals, protection from other humans. So food, which is a part of the physical security. But the other output is connectedness or emotional security. This is the sense that we belong to each other, that we're connected with each other, that we support each other. We all crave and need relationships with other people. We need validation. And that's a critical part of the output. And one of the problems that we have with our current form of economics is that the activities we carry out may well maximize or enhance the food and physical security outputs, the material outputs, but they do so at a cost by undermining our self-esteem and our sense of togetherness. So a well-formed and effective economy will focus not just on the material outputs, but on the emotional outputs as well. And then in this example, the other critical factor of this is that we create output. So in the food or physical security, you'll see I've identified little red and blue blobs. Those blobs are each intended to represent a unit of output. So in this case, there's 5 units of food output. And the different colors are supposed to illustrate which communities the outputs are shared with. So the arrows that come from the outputs and go around represent wealth distribution. And you can see with the food and the physical security, the output goes back up and is channeled back round to the people who create the inputs. And the same thing happens with connectedness or emotional security. It's recycled and fed back. And in practice, you don't have this sort of simple linear recycling. I just wanted to illustrate a point that the output of an economy is shared to the people who create the economy in the first place. And what you'll see from this chart is the share of output is not necessarily commensurate with the degree of input to the economy. So recycling, the output's recycled, and the thing I just wanted to highlight or to identify is the way that we distribute the outputs, both the food and the physical security, the connectedness and the emotional security, the way we recycle that and share that among the people who create the input influences the input they give to the economy. So someone that's starving, completely disconnected, perhaps suicidal, or just lost hope, they just cannot make the same contribution as somebody who's well fed, who's well integrated, and well connected and privileged. So there's a lot more of a concept about how the outputs and the inputs relate with each other. But I want to focus on one additional side, which is to describe a little bit what we mean by well-being. And I then want to bring this back to this whole concept of solving hunger crises. So I said that there's two aspects of well-being that an economy provides. Actually, there's three. And of course, there's lots and lots of different ways of doing this. So I'm calling it three, but you'll find other ones where there's 7 or 15 or 100, lots of different ways of dicing and slicing and dicing this concept of well-being. But I'm trying to keep it simple with 3 levels concepts of well-being. One of them is security, and that relates to physical health, mental health, and inner peace. One relates to connectedness, and this is the idea of having self-esteem that's arrowed back to your heart, mutual support, and common purpose. That's this idea of connectedness. Some people refer to that as spirituality, and some people take that spirituality to mean God. But this idea of connectedness, that we are connected with a higher sense of being than just our own selves on our individuality. So connectedness is connecting ourselves with each other and with nature and with the planets and the universe, if you want to go there. And then the final part, which is a really important component, it's one that the majority of people perceive when they talk about well-being, but which is very poorly understood in academic circles. And that's what I generically call stimulation. That's interests, challenges, pleasures. So if you can imagine that you're stuck in a jail, you might have complete physical security. You might have all the food you need. You might be connected to your other prisoners or inmates. You might even have a bit of a relationship with your prison wardens. But if you get no stimulation at all, your sense of well-being is drained. And the reason this is so important to understand is if you imagine a refugee situation where you've got a lot of people coming from one country or one economy to another, the question is, how willing are people to support those refugees? How willing are the natives willing to support the immigrants? And the answer depends to an extent on how secure they already feel, both in terms of the food they've got for themselves, but also in terms of their physical and health and other forms of safety, how connected they feel with other people, and the level of stimulation and excitement they get. And if their well-being is poor, as a generic concept, they're much less likely to want to help outsiders. Similarly, the contribution they make to the economy is much more likely to be prejudicial to the impact or the outputs. So this idea of well-being is a critical circular point about any economy, that if we treat people well, we make them feel connected, they will then produce better economic performance to create better outputs. So for the academic tier, I just want to talk very briefly about how you can model this. In this particular model, we have the very far right-hand column is the inputs or the outcomes, and this is well-being. And you can see the pillar goes up or down depending on how well or badly the economy is performing. But the inputs depend on a number of pillars, and the pillars represent the well-being economy. And they include things like structure of politics, the structure of society, social culture, the opportunity we make to people, the resources we deploy and the way we deploy them, and the reward systems that we have to encourage or discourage the right type of behavior. So very, very briefly, these inputs or these structural, the way we structurally develop our economy profoundly affects the output. And the opportunity that's available to us when we're trying to address hunger, if we're looking at it at a structural level, is to have a better understanding of how the economy is structured, to see if we can create better forms of structure to improve the outcomes. One outcome of which is better food security for everyone. So I'm just going to sum up this extremely whistle-stop tour of this concept of structural and well-being economics by identifying some of the opportunities that we as practitioners have got at our disposal of new ways of trying to secure better longer-term economic outcomes, particularly in chronic, in terms of chronic stresses. And just a few headline opportunities in the economic sense is to redefine the goal of economic activity by talking about sustainable well-being instead of monetary wealth, There's a whole movement called well-being economics, if anyone's interested in looking at that or participating in that, to seek and coordinate interconnected solutions. You can't look at solving hunger in isolation from solving other aspects of poverty, such as emotional well-being, sense of belonging and security, but also the impact of the people who contribute to the system. Improve alignment between business activities and social objectives. In the current version we have of capitalism, there's way too much emphasis on self-interest, not nearly enough interest in social objectives. And the way we can change this is through narratives, providing different types of status, and changing the reward system we have for businesses so that they're rewarded more in terms of sustainable well-being and less in terms of pure monetary gain. In terms of the cultural opportunities, we can raise awareness of the circular nature of economics through better narratives. We can develop culturally sensitive solutions to get people to participate more in the economy, to do more effective activities, and to reduce the barriers of contribution to the economy in the first place. The more people that contribute positively to an economy, the greater the sustainable human well-being we can achieve. And then the final part is to help strengthen self-esteem and the sense of connection with others, both in terms of the leaders, businesses, and volunteers, and also for people in need. So when we're running our own organizations, we've got complete control of the culture we have within our own organizations. And we could start to develop this self-esteem and connection. And that starts to radiate out if we do it in a more sophisticated way. So just to conclude, for anybody who wants more information about these concepts, if you want to understand more about well-being economics and how food security fits in the wider context, you can look at the website inclusivity.world, where there's both quite extensive explanations and quite an interesting suggestion about how we can model these. If you want to talk to me directly, feel free to get in touch with Nigel Cohen, Nigel at inclusivity.world. So thank you very much for listening. Bye.
Thank you so much, Nigel. That was so interesting. I'm sure there will be lots of questions around this area. Our next speaker, I'm just conscious of the time, is Dr. Lenin Raghuvanshi. Raghuvanshi, please go ahead. We have very little time left, but I'm just waiting to hear from you. Just to let you know that Dr. Raghuvanshi is a Dalit rights activist, a political thinker, and a social entrepreneur from Varanasi, India. And he has also been nominated for the Nobel Peace Prize for his efforts to combat masculinity-driven militarist traditions. Over to you, Dr. Raghuvanshi.
Namaste to everybody. I'm going to speak very little, 5 to 7 minutes. I'm already provided a lot of links in the chat box. Most important things, if you look, the first lockdown in 2020 and also the second lockdown in 2021. Like Mr. Tiwari, we also lost Mr. Chaube, and our 26 activists suffered with the very badly with the COVID-19. Why? Because most important things we need to learn from the philosophy of Buddha, who talk about the Ashtangic mark, a path of the enlightenment where is the right livelihoods. So we people born in little bit elite communities, and it is our responsibility as right livelihoods to support to others. 3-4 things I want to highlight. One important thing is the knowledge, attitudes, and the practice. So we always analyze knowledge, attitudes, and the practice of different communities in the villages, because our society is very much divided on the castes. So we also created the dynamics to create the more inclusiveness and the inter dialogue to understand each other's. So we are also mapping knowledge, attitudes, and practice, and also we are changing knowledge, attitudes, and the practice towards the elimination of the hunger and the malnutrition. And there is not only the food grain, water is also big problems in the society due to the climate change and also the caste-based and patriarchal society. Accessibility is the one of the biggest problem. Here we are going to highlight two, three principles: dignity, opportunity, empathy, active listening are the most important elements to support any community. And the second important thing here, not only we provided direct humanitarian support, also we approach to the government and the different agencies with our capacity, like a District Vigilance Committee on Food Security Act, and also the District Vigilance Committee on Bonded Labor, to give the more focus and the free ration cards to the free bonded laborers and the families, their children are facing malnourishments, and especially in the Sonbhadra districts and also in the Varanasi districts. They work very well with the different community like Ghashia, Musahas, one of the most marginalized community. So for me, it is long-term programs, but in the COVID time, there is a big problems. There is no midday meal schemes. There is no working of the ICDS people, and for that reason, we provided a lot of instruments as well as the equipments to the ICDS workers, ASA workers, health workers, because they need to protect themselves to help the most marginalized community. And this is also very, very important. And due to this advocacy and other things, also the dynamics of health structures change in this part of the India. And there is more investment on the primary health center and sub-centers, modernizations, and as well as the more equipment on there and more sensitizations. Also, we are involved one hand the malnourishment, and also we need to bring the vaccinations to those people. So nowadays, my last point, we are working in the 50 villages to eliminate the hunger and poverty, especially in the Mushar and Ghashia community. And we created many successful communities. There is no hungers, no malnutritions. Through the breaking the culture of silence, this by the phobia and the fears created by the caste system and the patriarchy. So we provided the platforms and we provided the empathy, dynamics and the mechanism for the well-being, and also we promoted the active listening, and through that we eliminate the culture of silence and we create the resilience, and community also involved to create their kitchen gardens. They develop their own kitchen gardens, and that time we supported to the children, especially in the second lockdown in 2021, near about 3,000 children supported by our food schemes in the memory of Shri Pratap Chaube, who lost his life to fighting this coronavirus sufferings of the other human being, and he worked our organization more than 30 years. So that is our work. The most important things, we need to be develop some values in this type of work, especially the empathy and opportunity, dignity, and inclusiveness, diversity, different opinions, because we need to support our different opinions. We work with the Brahmin Mahasabha to develop the Neo-Dalit kitchen, and the Brahmins volunteers free of cost supported to the distributions of the foods, and they prepare the food also free of cost. So that is also important to create this type of things. So it is my small presentation. Thank you.
Thank you very much, Dr. Raghuvanshi. I'm sure there will be lots of questions. Can we just take the questions, please, now? If you could just unmute yourselves and just ask the questions, anyone?
Thanks, Sanrita. I was just keeping an eye on the chat box as we were going through. So I don't think that anybody has really put any questions in on the chat, but like you said, people are welcome to unmute themselves if they would like to ask a question. But just can I follow through and say thanks so much to all of our speakers, and Dr. Lennon, sorry, thank you. I know you spoke for a short time and we could listen to you so much more there at the end, so apologies for that. But I was really struck by, I suppose, all of the presentations and that kind of sense of community. People spoke so much about kind of empathy, a sense of humanity. And, you know, and even though there was different theories throughout and people had so many different experience, there was really that common trend. And also just even in the sense that, you know, when we talk about food security, you know, it's so much more than just a lack of food. It's about good, nutritious food. But also Nigel introduced us to, you know, something that is really critical as well in terms of that emotional security and the emotional well-being, and that food is not just food per se, that it's so much more than that. So thank you to all of our speakers. And I suppose I have a question. I'm going to kind of put it out there, and you know, any of the speakers are free to answer this. But it's really around the sense that we know food security, and it's such an issue. And it was really good to have the two, but you know, in terms of food security in the UK and also in India, where we know that malnutrition, and Annika gave us some really nice values, or not values is the wrong word, but in terms of the percentages that we have present in India of malnutrition, which is really quite striking. And we don't necessarily see those same values or percentages of malnutrition in the UK, but yet we know food poverty is very much a real issue. And I'm just wondering, in terms of how can we begin to escalate you know, Nita, I know you spoke very much around the Stop Hunger movement, and I don't know if, you know, you want to talk a little bit more around that in terms of whether you see this being one way of taking this up a little bit further in terms of creating a bit more of awareness globally around the issue. And you also mentioned, and I suppose other speakers as well, around the importance of, even during the COVID pandemic, around how the food banks became more than just the food banks, and that, you know, they were also maybe distributing PPE as well, which was hugely important. So I don't know if Nita, you want to address that, or if any of the other speakers want to come in, because it was quite a broad question as well.
Thanks, Jacinta. That was a good summary. I think I'm not an expert on the broader movement, but from my own work in India, and from what I do a little bit in Ireland, and from what the literature survey or the review that I did for the UK, it comes what comes out, and from listening to Dr. Raghuvanshi and Nigel, is that, like you said, it is the community. It should be at the community level. And these values that we've all spoken of together has come out very strongly, and this is the way to go forward. So even if we have formal organizations, these values of interdependency, of linking, of the fact, you know, of empathy, or of sharing, or of listening to the other, should probably be taken forward. I mean, my own experiences of talking to duty bearers. When I say duty bearers, in this case, I'm talking about the state level of officials at the district level in Orissa, for example, during my PhD. Some people, and at times they did not follow the rules which are there under ICDS or the Department of Women and Child Welfare, and that was all right. So if the Anganwadi worker was not following the rules to the T, it's fine because she is adapting to the local situation, to that village. And these are the openings that we should look at it as positive or as taking initiative all over wherever there is a food security or where there's food insecurity. And there should be guidelines and rules are there to help us, but the final idea is how we exercise that at based on local needs. I don't know what maybe others may add to this.
Thanks, Nita. Yeah, no, I am completely agree. And I don't know if any of our other speakers want to make any comments at this stage or contribute. Check, have we any other questions? Thanks. Neve has just made a comment there in the chat box, but really an appreciation to all our speakers around how thought-provoking the webinar has been this morning. So thanks very much to everybody. And yes, I
Can I just wanted to know a little more because I just heard today only from Ankita's presentation that there's this Pradhan Mantri, that the midday meal scheme is now called something else and that it is different from the earlier midday meal, which I did my research on. So you're saying it's called the Pradhan Mantri, what I forget the name that you mentioned. So how is that different and from the earlier one? And anybody, maybe Dr. Raghuvanshi or Anju. Yeah, thanks.
Or you want to go, Ankita?
Ma'am, yeah, you can take this. Yes.
No, actually, the Pradhan Mantri Poshan Shakti, I always call it Yojana. It's some other word. That's essentially to encompass all the innovative techniques that the government is introducing now. One such innovative technique is, as I mentioned initially, the Tithi Bhojan. There is a tradition, a Hindu tradition, I would say, because I'm more familiar with that. But there's a tradition in, I think, almost all the societies, communities, to offer a meal if there is a birthday or if there is a bereavement in the family. And the Pradhan Mantri has come forward to encouraging the community to say that if you have a Tithi Bhojan to be offered, please offer it to the school children. So this is one thing. Then similarly, there's another thing which was introduced some years ago, and that was the school kitchen, nutritious kitchen, which is an excellent thing. And that particular thing is that every school, even if it doesn't have a garden, should have some plants, some herbs, some produce, which the children would learn how to plant them and how to reap them and how to use them in the food. So these are various innovative tools that the government is in the process of undertaking. And before the event, I happened to be talking to a handful of people here in Delhi who are involved with this. And I was very delighted to see that actually nutritionists are involved in it, consultants are involved in it, and also that people are trying their level best. For instance, each evening before the school closes, an automatic phone call is generated to get data as to how many children have had their meals today from the school. So this is something which is interesting as well as worth watching. So I don't doubt the intention. And also, if you simply said, school meals and Googled them, there will be a tendency of getting adverse responses that this and this school served just bread and salt. This and this school had, an insect in the cooked meal. But by and large, it's a gigantic project. It's huge. 13 crore kids getting hot meals served, which is now monitored, which is, now also, which also involves the community, is something which is unbelievable. And to that an extent, the government needs to be given its credit. There is a proper percentage of how much food is to be given, how much money is to be spent on the condiments or oil or protein or micronutrients, and each school is to conform with them. So we are actually right now mostly interested, if I'm right, Samrita, correct me if I'm wrong, mostly interested in the new forms of organizing, of distributing, ensuring food security, especially for young children. And that's where the Banaras segment of this project was focusing on in association with other issues. And therefore, this was not so much about talking about food security as it was about the various forms through which food security, how it moved the humanity, how it moved people who were otherwise not in the direct official hierarchy, whose official responsibility was not to provide food, but people like Lenin, people like Shiluji, who works for Jeevan School, people like Tiwari-ji, and there are so many others. And there were so many questions in the beginning. We talked about how decisions were made. And I recall during the pandemic, when we were under lockdown, I think it was the first lockdown, because a lot of talk was being done, who is most deserving to receive these food packets? And people like us would be, friends who were doing this, we would be called and asked, is it okay to distribute food to this and this community? And whatever little we could advise them, we did that. So this is something which we focused most. And once again, I would simply like to state here that India is home to 1/6 of the total global population. And the challenge definitely is that each year we add to so many more people. And employment and employability is a challenge, it's an ongoing process. As I said during the opening remarks, it's dynamic, it's not static. Who knew before, say, 2019 December, that the challenge will unwrap itself in this form? And we, thanks to the internet, we were still connected, and there were innovative ways of not only providing nutrition, but also providing education, providing raising data, and ensuring that all of us are in the net. And so my understanding to this entire phenomena has been, we did fumble on so many issues during the Corona crisis, but on this issue, as much as one can see that there has been a remarkable initiative that has been there. We can't say that on a scale of 10, we were successful at the rate of 9 or 7 or 8. Only time will tell how successful we were. All those lactating mothers who did not get their enough nutrition, what happens to their children when they grow up because they didn't get enough milk, nutritious milk, while they were growing up? Only time will tell. But for the time being, I would say that the effort and the initiative that the community came forward with was very appreciable. Thank you. I'm sorry if I took more time than I was required. No, I was allowed.
No, Andrew, thank you. That was that's fantastic. And Samrita, I see you've unmuted yourself. Did you want to contribute?
Yes, I just wanted to say that I completely agree. After hearing from Nigel, from Dr. Raghuvanshi, from Neeta, and also Ankita, even though we've been through really dark times, I can see that all these new forms of organizing, they have been in some ways, working closely, engaging communities, and they are somehow contributing to the circular economy, which is a positive thing, I think. And I think most of these, new forms of organizing, little organizations that we have heard today, they have focused on really good values, core values, and that is a promising thing. I think, that is really promising. And although there are several challenges, I know, but I think even though, we've been through very difficult and hard times, I think there are some positive things, and at least I should take this away from today's webinar, that there are things which are really good, and lots of small charities, small local organizations, and have done a lot of good things, and we should bring this to the forefront and make this much more visible to the people, so that your good work is communicated. Yes, Nigel, you wanted to say something?
Yeah, I just wanted to add a perspective that the work we do in this area is notoriously difficult to quantify. We can measure things like calories, but as a number of people have said here, hunger is not necessarily representative of everything that's going on. This is nothing new, of course, but as you say, with lactating mothers, we'll never really know the impact that the malnutrition has had on the children in the future. And my guess is that the impact of food insecurity is way greater than we actually know about, because we just don't have the means or mechanism to measure it. But I just wanted to highlight the converse side of that, which is when we do work, particularly at the local levels, and I think everyone on this webinar will be able to have an impact with this, but when we do work at a local level, it's not so much the measurable impact that's had, but the influence you have on how people interact with each other. So when we go into schools in Maidenhead with the food share, we don't provide meals just for people who have food insecurity. We simply provide we do breakfasts. We simply provide breakfast for anybody that wants it. What we're trying to do is to desensitize, to disconnect, to decouple the idea of people who are in need having food from everybody else having food. And this whole sense that when people from the schools know that there's other people who are in poverty, they don't necessarily know who they are, but it completely transforms how they then address their own impact in respect to other people. So as I said, it's the work we do, and Len, some of the stuff you do is just absolutely amazing, that it's not so much the quantifiable outcomes, because as I said, I just don't believe you can measure these. That doesn't mean there are no measurements that are valuable, but I don't believe we can measure the whole of what we're doing. But I just wanted to highlight or identify that just simply getting involved in this sort of thing, and particularly highlighting it, talking to people, letting other people know what you're doing, is extremely inspiring in creating this sense of community and togetherness, and trying to develop more solutions, even though we can't necessarily quantify them. And the idea of providing solutions that are tailored to what's needed by a local community in their particular need at that time is such a big deal, not least because if you've got 3 people, all of whom have the same food insecurity, their perspectives of their sense of insecurity will be so different from each other. And the only way that you'll know about it, about how best to respond to it, is by having sort of local one-to-one awareness. So I just wanted to underscore that these things are very difficult to measure, which means when we're doing statistical analysis, it becomes sort of horrendously difficult to get a full picture. But don't lose sight of the fact that we're doing some fantastic work, even if we can't measure it, and keep doing that great work.
Yes, absolutely. Thank you, Nigel. Does anyone have any other questions? Any final word?
Just Sunita, there's a question there in the chat box from Neve. Neve, will I read it out, or do you want to speak to it? So it was a question around the double burden of malnutrition, and where we have this coexistence of kind of undernutrition and overnutrition side by side, and it's well documented. And her question really is around in terms of with the undernutrition being such an issue with COVID as well, increasing the levels of undernutrition, should that just be where the focus is? And I suppose she's kind of bringing into the question of, probably a little bit of where some of the speakers alluded to it already, that, overnutrition is definitely on the malnutrition scale as well. And, it doesn't necessarily mean that people are well nourished either. But I don't know if one of the speakers wants to take that
Yeah,
question.
I think Dr. Raghuvanshi has already replied to that. Maybe you want to say something, Dr. Raghuvanshi?
Yeah, already we are working because we observe this Musar children, most marginalized children, they also use the packet food. And then we started to work because I faced 12 days ICU in the COVID, and through the help of the nutrition, very good nutrition and well-being, I recovered very differently. And then we started a campaign because packet food also used by the malnourished children. And so we don't want to discourage, but we want to promote the FOPL, front of the package labelings provided by World Health Organizations. They give the alerts, more sugar, more more salts, more fats, because it is the biggest problem. I gave a link here where I wrote recently some points on the double burden of the malnutrition and the overall nutrition. So it is very linked, and this packet food came everywhere. Coca-Cola and Pepsi came everywhere. So that is the issue.
Yeah, in fact, the Akshay Patra Foundation is trying to, in Orissa, taking over some of the midday meal and ICDS packaging as opposed to hot cooked meal. So that's a very different issue. Thanks for bringing it in.
Yeah, thank you. Thank you, Nate, for that question. Does anybody else have any other questions or comments or final words?
Yes, am I audible to all?
Yes, we can hear you.
Good evening to everybody from India here. I am Brajesh Chaturvedi from Safe Society, Gorakhpur, Uttar Pradesh. During the experience, during the COVID period, and we were working with the street childrens, and administration has given us the place where the maximum of the street children were there, but we were not able to provide the food in a way that should have been given to them. And just we conducted a survey in Gorakhpur city where we found that 19% of the child laborers family do not have the ration cards. The godowns of the different companies or the government companies related to the food security, those are filled. There is no lack of food in India at present. But what I feel, there is lack of coordination between the departments of government, and the different NGOs or development agencies are also working in an isolated way. The need is to combine all those ground level NGOs, the mid-level NGOs, and the state level NGOs or national level NGOs to give a proper advocacy. Just I heard some people that the good monitoring is going on through the monitoring of food security. It may be at some place, or some initiative would have been taken at some place, but there is need to have a collaboration of all level of organizations, what I was talking about, and to do a proper advocacy for the specific spot, like in any village, in any city, in any location. Because there is no need, there is no shortage of any food in India now, and the surplus food is misutilized. So any initiation is being done. I am happy to see many faces here, basically from the Varanasi city. They are working in a very nice way. We have also worked and suffered a lot to just to provide the food to all, and we also provided the emotional food, because we believe that only the physical food is not required, the emotional food is also required. So we call these street children and all the slum children at our community radio also for the psychological healing and art-based process, and we provided all those things, and very positive results were there. And you will be surprised to know that these street children never steal something from anybody. So it was very good impact in them. And they started doing some work when the lockdown was released. They started doing some job in different shops. So what I want to say, we need to have a collaboration, because a collaborative work is having a good pressure, or you can say it is a pressure building mechanism. And through that, we can do the specific advocacy at particular village, at particular city, then the results will be there, and there is no shortage of just the things in India. But we can allocate the things through these channels. If something is going on in Varanasi city, because many faces are there from that city, if anything is there, we will be happy to be the part of that. And it should be needed at the India level also. Any reply?
Thank you so much, Bharat, and thanks for sharing that with us. Yeah, you've summed that up beautifully. Does anyone of our speakers want to make a comment?
I think, Nigel, would you like to say something about the situation here in the UK? Do you think it's quite similar here as well?
Yeah, I was just actually typing that. I thought there's some fantastic points you've made, and just echoing what a couple of other people have said. This idea of emotional food is just such a great phrase. But yes, so I'm actually struck at how similar some of the issues that we've got and the solutions we've got, both in India and in the UK, and in particular in Maidenhead. Which is quite bizarre considering the difference in sort of the respective wealth of the countries, but it's just remarkable. And I think it boils down to the fact that we're dealing with humans and human suffering, and we're all people, we're all the same. So it's not surprising that the solutions, the emotional food is such a big part of the solution. And certainly we see huge impacts in the UK. We sort of started off dealing with people who are homeless and then progressed through into the food bank. That the way you treat the people coming in is completely transformational in how they then respond subsequently. And one of the big problems with the official support for people, particularly in the UK, is how people are objectified and dehumanized and demeaned for daring to accept support, sort of demand support. They should be able to look after themselves. And this whole concept, when people go in to get support from the government, is very much one of that they've done something wrong, and it's humiliating and demeaning. So when you deal with street children, when we deal with people who are homeless, and in fact, it's actually not a poverty thing, because we have people who are actually quite wealthy who get themselves into emotional spirals, financial spirals, and find themselves in need of the food bank. And it applies equally to them, that the way you respond to them, it completely transforms how they feel about themselves and how comfortable they are to get themselves out of their own situation. And I should say that, ironically, it's not just the people who are in need that you're influencing with the way you deal with people. It's also other people who can help, other potential volunteers, donors, governments. The more positive values that you can apply, the more respect you have of everyone, regardless of their circumstances, this unconditional positive regard, the aspiration to support people regardless of why they got into that situation, just simply if they need help. It's very influential, and the more positive we can be about these things, the more influence it has on other, as I said, donors, other volunteers, and you create this sort of virtual cycle of better and better and better support and solutions. So I love hearing what the work that you're doing with the street children, and I love the encapsulation of they don't steal, not because per se it's such an important deal, but because so many people who look at people in poverty see this theft, people are deserving of their problems, that's all they can see. And in that one comment, you're almost negating this whole perspective, which is a barrier from people getting help and from then starting to contribute back to society. So I love what you're doing. Yes, it does have echoes over here. Yes, I think the emotional food is a fantastic term. I love it.
Thanks, Nigel. Yeah, absolutely. And I think we're just a little bit over time now. I am conscious, I suppose on behalf of myself and at DSAI, I'd like to thank all of our speakers.
Sorry, can I just interrupt for a second, please?
Yeah, sorry, Neeta, go ahead.
I think Dr. Raghuvanshi was supposed to say something.
Oh, sorry.
Yes, yes, please. Yeah.
No, I support the Brajesh Chaturvedi. Please come on the 2nd December. We are going to organize a very strong meeting. A.K. Sharma and many politicians are going to involve. And we are going to talk about the FOPLs and the Diamond Hotel. So please come. Many politicians and especially the Modi's teams also going to involve, because we are going to make accountable to them from our city. So FOPL is going to happen and we will coordinate.
Thanks for that. Is this online also?
You're on mute, Dr. Lang.
You're muted, Dr. Raghuvanshi.
I already tell my points, because coordination is very important, and we are doing. I told to Mr. Chaturvedi there is a meeting on the 2nd December, so he will come. And FOPL is very important, and we are putting the pressure on the governments, because many big companies like Coca-Cola, Pepsi, and these Maggie's and all, and also Adani's are opposing, but very fantastically Modi is supporting. So.
Oh, that's amazing. Great news. I was just wondering, this meeting, is it online also, or is it just in-person meeting at?
No, this is the in-person, only online. A.K. Sharma, who is from Vice President and the person of the Modi, he is going to join online. And also from the Bloomberg Philanthropy, Bandana Shah is coming from Washington, D.C. to participate physically there.
So but can people like me attend?
Yeah, it is going online on the live. I will send the
link.
Facebook.
Thank you so much. Yes.
Fantastic. Yeah, and definitely we can share the link around with within all of our networks. So yeah, thank you for that. Apologies. Does anybody else want to have before I pass back to Sunrita to close the session? There was just Nigel unfortunately had 2 videos and recorded, and one of them is about the introduction to his organization, and we can share that at the very end and just leave it playing if people want to stay on and they can watch it. Alternatively, Nigel has shared the link in the chat, and he has also put it into the actual Zoom as well. So if people are watching it back, they will be able to access that as well. So I can play it at the end if people wish to stay on, or if they need to leave, that's fine as well. They can watch it in their own time. So thanks again very much to all of our speakers. I found the session really incredible, and a real sense of kind of hope from everybody, and you know, the importance of, I suppose, the real takeaway message is the importance of kind of emotional food and emotional well-being. So when we think about food security as well. So thank you all for that. And I'm going to pass back to Sunrita to close the session. So thank you.
Thank you, Jacinta. Thank you for organizing this as well. And I would really like to thank all the speakers, especially Dr. Raghuvanshi, Nigel, Neeta, and Ankita. Thank you very much for sharing your stories. And I just wish we had more time to continue the discussion. And of course,
you want to ask everybody to open their videos if possible and take a screenshot of all of us who are here.
Yes, if that would be really good, if you don't mind, just
faces.
Yes. Yeah. That would be really good.
Can somebody that's technical take a screenshot? Thanks, Annika.
Ehi, can you come on screen also, Tom? Ranaji?
For some reason, I don't know why my video is not coming on.
Okay.
No.
They're caught unawares, I think.
It's coming on now. Wait for me, please.
No. Yeah. Surabhi, Ruby,
let me cut and come back.
Narenji, Lakshmi. There.
Oh, there you are, Obehi.
Tom.
Hello. Thanks for waiting for me.
Hi.
Great. Happy birthday to you, Tom.
Thank you. I was here. It's just I couldn't find my button. That for some reason the screen went a bit strange.
Oh, okay.
Okay.
Actually, it's lovely to see everybody's faces. So yeah, thanks. That was a good.
That's really good.
A picture of all of us when you're there. Ajay, why have you hidden yourself? There. Ruby?
Maybe Ruby is not there.
Thank you so much, everyone. It was really lovely seeing you all, and thank you for joining us. Jacinta, it would be really good if you can share the recording so that people can watch it.
I'll share the recordings, and also if people are happy to share any slides or anything, we can send that around as well. So yeah, absolutely.
Yeah.
Yeah, perfect. And I will leave the stream running, and I unfortunately need to go to another meeting, but I will run the video link now for Nigel if people wish to stay on. That will be running. And Nigel, thanks. I know you offered to stay around if anybody had any questions. So, yeah.
Thank you, Jacinta. I think we have got the links for Nigel's video, so we can all watch it in our own time. So that's absolutely fine. We can finish and you can stop the recording so that you have that.
Okay, Nigel.
Okay. Thank you very much.
Thank you so much.
Thank you.
Yeah, thank you. Bye bye.
Thank you,
Bye.
everybody.
Bye.
Thanks a lot to everybody.
Yeah, bye-bye.
Bye.
Wow. Great.